So if you want to be a respiratory therapist, one reason that I also enjoy being a respiratory therapist is nurses need to deal with poop. I don't deal with poop. I tell people that I work from the belly button up. So that's how I would convince somebody to go into respiratory.
Hi guys, Christian, aka CMoneyRN here. Welcome back to my YouTube channel. I am back with a special guest, and his name is Austin Marks. And fun fact, we've actually known each other since we started our YouTube channel. So he's an RT, and I'll just give the floor to him. So Austin, if you want to introduce yourself.
Yes, so my name's Austin. I've been in RT for almost 3 years now. It's crazy to think. So I had a year under my belt before this whole pandemic happened. Respiratory was needed a lot during this pandemic. I primarily work in the ICU as well as the ER. I'm involved in traumas. However, I do work on the floors. I don't personally do NICU, but there are respiratory therapists who work in NICU. But I am a traveler at this moment. I love traveling. I am a local traveler, so I travel about an hour and a half from my home, and I love it.
Oh, wow, nice. So besides, kind of just telling about yourself, what, inspired you to go into that respiratory therapy route, if you can tell us? There's different medical professions out there. Why RT in particular?
So, like many respiratory therapists, we all thought about, not every respiratory therapist thought about this, but we all thought about healthcare. Everyone thinks of nurses and doctors, right?
Mhm.
So then I was looking into the nursing program, and then I also saw there were some other specialties such as an X-ray tech or a respiratory therapist, and I was like, I wonder what that is. So I looked into it a little bit more, and I got in contact with the administrators at the school, and they both kind of sold me on their programs. However, the respiratory therapist sold me a little bit more and led me more down that path. So that's how I became a respiratory therapist.
All right on. So I'm glad that you're able to, find that field. And do you like it, working as an RT currently? I'm sure
I
you
love
do.
it. I love it. Yes. I have a compassion for it. I like working with patients. I like healing them, making them better. One of my favorite things is taking people off of life support in a good way, and having them actually talk to me once we take the tube out, and just telling me thank you. Sometimes they give me the middle finger, and that's okay too. I'm just glad they can talk and they're getting
Yeah.
better.
So you kind of brushed up on it already. You kind of find the opportunity of taking people off ventilators to be rewarding. Same thing as an ICU nurse. We love that too. We work together hand in hand in our departments. But what do you think is like something that's challenging, working as an RT? What are some challenges that you've run into?
So I think the most challenging part for me, like I said, I work in the ICU a lot, and not
Mhm.
everyone who goes into the ICU comes out alive. So I said that I take people off the ventilators or the life support, and unfortunately, it's not always for them to live and thrive. Sometimes it's the end of life, and the family will make that decision. Maybe the person made that decision, and essentially I'm the one who pulls the plug. The nurses also will give the medicine and make the patient more comfortable, and it's really hard once I become friends with the family members. I become friends with the patient, and I know that they're going on to a better place. They are passing away in the way that they want to. There's a compassion for that, and I am there for the patient 100%. I want their wishes to be completed, but that is the hardest part, is dealing with the death.
Yeah, I've addressed that same topic in another video before, just addressing death. But I feel like kind of like sad but true, but the more you're involved in doing it, the more you're kind of used to it, right? So I'm sure your first death was very difficult on you.
Yes,
Yeah.
definitely. One thing that I encourage everybody, do not get involved in ethical drift. So essentially, always have that compassion for the patient. Do not treat the patient like a number, treat them like a person, because how would you feel if you were in that bed or you had a loved one in that bed?
I totally agree with that. And I really appreciate that perspective too. I feel the same exact way. So it's like putting yourself into another person's shoes. And then you're also trying to relay that to the family, the loved ones, significant others, and everyone. So that way they can understand. And then we're kind of just like a big part of this whole team here. So that's really cool that we work in the same department as each other.
Yes, I'm friends with all the nurses because, like you said, we're a team. We work hand in hand. So
Yeah.
I have a problem, I get them. They have a problem, they get me. We are a team. We are here for the patient, and we just do everything that we can to make the patient better and just get them out of the ICU because nobody wants to be there.
Yeah. No one wants to be in the ICU. That's always the number one goal. So just a general question, for the viewers out there that want to go into the RT route, how long does it take, to become an RT? Let's say I'm newly graduated from high school, right? I'm a freshman in college and I want to go become an RT. From the point of starting to becoming an RT, how long does it typically take?
So it takes about 2.5 to 3 years. We have
Hmm.
associate programs just like nurses. You can go get an associate degree, or you can get your bachelor's degree. So most places will hire you with your associate's degree. However, they
Okay.
encourage you to go out and get your bachelor's degree. So there isn't a huge pay difference between having your associate's and having your bachelor's degree. Some hospitals may give you a little bit of a raise. However, I tell people all the time to go get your associate's degree and then have the hospital pay for you to get your bachelor's degree, because I also encourage everybody to go out and increase your education because knowledge is power.
Yep. I agree with that. Knowledge is power. So that's kind of like that route. So typically like about 2.5 years or so.
Yep, exactly. And you don't
Okay.
have to be a high school graduate. You can be 40 years old. I went to school with a guy who was 42.
Oh, cool. So going back, you talked about the criteria is you need to have like an associate's degree, but nowadays people want bachelor's. It's the same for nursing, but if you can kind of brush up, I hear these two terms a lot. If you can kind of like correct me, there's certified respiratory therapist, and then there's a registered respiratory therapist. Is there like a difference between those two, or are they kind of like the same? Like is one associate's, one's bachelor's? Maybe you could elaborate.
So for the nurse program, they have the NCLEX, or is that how you say it?
Yeah. Yeah.
Um, but for the respiratory program, we actually have to take two tests to be
Hmm.
get licensed. So our first test is called the TMC, therapist
Hmm.
multiple choice, and with this one, if you pass it, you get your CRT, which is a certified respiratory therapist. Um, However, if you score high enough on that test, you get to take the next test, which is the CSE, which is the clinical simulation exam. And then if you
Wow.
pass this test, you become the registered respiratory therapist. I know it's a little confusing. So
Yeah.
essentially, you need to pass the first test. You need to do super good. That way you can take the second test and then you can become an RRT. Now, most places won't even hire a CRT. They want
Hmm.
you to become an RRT, which just shows that you are better at taking a test, but
Right. Right.
also that you have more knowledge and you are able to use your skills.
Gotcha. And then just a couple of questions I have for you. I'm actually learning a lot just talking to you right now. So what do you think is what are some things that you wish you knew about becoming a respiratory therapist like beforehand? Going through the program and all that that you wish you knew back then before starting out.
So, going through the program, when we're respiratory in general, um, I wish we'll start off with school. So, I wish I knew how to study. I wish I knew how to take
Hmm.
the test, how to gain all this knowledge, because in high school, I just kind of went with it.
Yeah.
But college is a whole different ball game. I'm
Hmm.
sure it's the same for nursing. Um, there's a lot of information. You're learning a new language. So get your studying down, learn different techniques, and learn what works for you. That way, when the test day comes, you're going to ace it.
Awesome. Thanks for addressing that one. And then
Yes.
how and then how about kind of like nursing, how you can go into different, fields and specialties. Talk about, as a respiratory therapist, are there like any additional ways to advance your career? Like once you become a CRRT or an RRT, like what can you do after that to advance your career?
So you are a respiratory therapist. You are
Hmm.
stuck in the respiratory world. However, there are so many different things that you can do as a respiratory therapist. So you don't have to work in a hospital. You can work in some clinic.
Mhm.
So you can either work with adults, you can work with babies, you can do home care, you can do pulmonary rehab, you can do pulmonary
Mhm.
function testing. The list goes on and on. But essentially, you can also get specialized in different things as well. So you can get your neonatal pediatric specialist, you can get your
Right.
adult critical care specialist, and then our creditor, so the ARC, which stands for the American Registered Respiratory Therapist accreditation, just released that they are going to be looking at an advanced practice program. So this is known as the
Wow.
APRT. There is one class that has actually graduated from a program. A lot of things need to go on with legislation. I personally don't see that becoming a thing for another 5 to 10 years.
But in 5 to 10 years, when it does become a thing eventually, is that something that you kind of see yourself in a couple of years doing and pursuing?
So I personally have looked into PA school. I was
Yeah.
very close to applying, and I have my bachelor's degree. But if the APRT came and it was going well, and I've seen more and more get jobs, I would go for it.
Awesome. Yeah, I'd say go for it, man, if you can. Sounds like an awesome route. I read about it too. So, thanks for, clarifying what that was. That sounds awesome.
Yes, yes, it's very exciting. One also exciting thing, the people that did go through the program, they didn't know that if it was going to be a thing or not, but
Yeah.
they went through essentially tuition free. The hospital paid for it,
No way.
and they're just kind of hoping that everything works out. And there are bread and butter. They are the head of the respiratory therapy field.
Awesome. All right. One last question before I let you go, Austin. What is one piece of advice you would give like a prospective student, that wants to go into the RT route? Like, what would you tell them? Let's say if I was a student, now I'm like, hey, Austin, I want to become an RT. What would you tell me?
So I tell people to look at all aspects of healthcare. So don't just look at RT, look at nursing, x-ray tech, physical therapy assistant. Maybe you want to become like a PA or something. Look at
Mm-hmm.
everything, because like I said, I only thought about nurses and doctors, but there's so much more out there. So if you want to be a respiratory therapist, one reason that I also enjoy being a respiratory therapist is nurses need to deal with poop. I don't deal with poop. I tell people that I work from the belly button up. So that's how I would convince somebody to go into respiratory.
I like that one. I'm going to use that for my intro. But anyways, thank you so much, Austin, for taking your time. I know you're a busy guy just like me, for talking to me. Like I said, guys, the purpose of this video was to explore, a different route as a field. All my videos are focused on nursing, but I want you guys to kind of get a perspective from an RT. So if you're watching this video, you want to get into healthcare, definitely consider respiratory therapy as a career path. And if you have any additional questions, I'll include Austin's information, his Instagram, his YouTube page. Watch his videos too if you want to go into that respiratory route. You have anything else you want to say, Austin, before we go?
I don't think so. I appreciate you for having me and just having this discussion. And I hope that I convince someone to go into respiratory.
Thank you so much once again. All right. Thank you guys so much for watching this YouTube video. If you haven't yet, subscribe to my channel at CMoneyRN. If you have any additional questions about nursing, Austin's also going to post a video where he interviewed me about the nursing field. So don't forget about that video as well. And thank you guys so much for watching, and take care.